This presentation is on Nicoya, Costa Rica, one of the healthiest, happiest places on earth, and is presented by Anna Schulte, Michaela Smith, and Lucy Waterfield. According to the WHO, Costa Rica has the highest healthy life expectancy of the Central American region, being just second to Chile among all Latin American countries. What is a blue zone? Blue zones are geographic areas of the world where their population lives longer with lower rates of chronic disease. Obesity rates are lower as well as cardiovascular disease, which is the #1 killer in the United States. There are 5 blue zone regions in the world that include Okinawa, Japan, Sardinia, Italy, Nicoya, Costa Rica, Icaria, Greece, and Loma Linda, California. In this presentation, we will be focused on the region of Nicoya, which is located in Costa Rica. Nicoya, Costa Rica is the largest peninsula in the country, and it is south of the northern Pacific coast of Costa Rica. The Nicoya Peninsula is a gulf in the Guanacaste, Costa Rica, and its biological diversity, location, and beautiful beaches have made it a major destination in the country. In 2018, there are 154,784 Costa Ricans in America. Like Nicoya, there is a blue zone present in the United States. It is located in Loma Linda, California, and the population is made up of Seventh-day Adventists. Today, a community of about 9,000 Seventh-day Adventists make up the Loma Linda population. They live a decade longer on average than the rest of the United States. They live longer because of their vegetarian lifestyle and regular physical activity. They also do not consume alcohol or smoke. Loma Linda also has similar values of the Nicoyans as they set time aside every week to focus on family and friends. The diet practices of the Seventh-day Adventists and Nicoyans are similar as they both consume light dinners, focus on consuming plants, and drink lots of water. Overall, there's lots to learn from the Seventh-day Adventist lifestyle as they live a much longer life than the rest of the United States. What makes Nicoya unique? Cultural traditions are rooted in Nicoya, Costa Rica. Caring for the elderly is very important to the Nicoyan community. Nicoyan citizens live by the mantra Plan de Vida, which means life plan, and it fuels the community's passion for overall health. The citizens find a way to enjoy tomorrow and do not focus on reaching a certain age. As the centenarians age, they find a higher sense of purpose by providing wisdom for their loved ones. Their priority and source of happiness is family. Nicoyans enjoy physical work all of their lives and find joy in physical chores. Nicoyans also spend ample time in the sun, which helps their body to produce vitamin D, which enhances bone health. Overall, Nicoyans live a simple life with family at the center of their lives. The diet in Nicoya, Costa Rica consists of bananas, black beans, papaya, plantain, and homemade corn tortillas, as well as yams. They consume black beans and white rice on a daily basis. All of these foods are locally grown and prepared fresh. The Nicoyan diet is high in antioxidants, potassium, soluble fiber, niacin, vitamins A, B, and C. They also consume hard water, and the Nicoyan water has the country's highest calcium content. Nicoyans consume a light dinner, and their meal focuses on what they deem the 3 sisters, which include squash, corn, and beans.
All right, hi, my name is Michaela, and I'm going to go through the common conditions and diseases in Costa Rica. So although Costa Rica is an extremely healthy country with a high life expectancy, especially for the Nicoyan people, there are still diseases and conditions in the country. So there are 6 very common diseases within Costa Rica, but malaria is the most common of them all and what we will focus on. It is transmitted by parasites living within mosquitoes and typically presents itself in the individual through symptoms such as chills, headaches, and fever. It is important to note that it could take 10 to 15 days for the symptoms to set in, so caution should be taken to avoid mosquitoes. It can actually become life-threatening. However, it is preventable and treatable, so we'll go through specific care that can be taken later in this presentation. And as with all countries, there are certain medical conditions that are unfortunately present. So the most prevalent one for Costa Rica is diabetes. Some common symptoms for this chronic medical condition include increased thirst, increased urination, tingling or numbness in the hands or feet, blurred vision, frequent infections, increased hunger, unintentional weight loss, and fatigue. This is not an unknown medical condition, so there are many treatments for it. According to the Mayo Clinic, a diet high in fiber and low in fat, along with time set aside for aerobic exercise, is the best way to manage diabetes. There are many medications and insulin therapies that can be utilized as well. And all of these will help anyone that has diabetes live a long, healthy life. The important thing to remember is that although Hispanic people, such as those from Costa Rica, are more prone to having type 2 diabetes, it is something that can be controlled and cared for and prevented. The management of diabetes is also something that will affect that person's life every day, so we must always remember this and provide adequate teaching. Additionally, it should be noted that the numbers of those getting diabetes in Costa Rica, specifically the elderly, are increasing in number drastically, as can be seen on the graph on the slide. And the people from Costa Rica, they can handle this and all of life's other troubles. So this leads to our next point regarding their spirituality.
Hi, I'm Anna, and I will be talking about spirituality. So, spirituality is a central part of the Nicoyan culture and their overall well-being. In fact, their shared beliefs and health practices are the reason this culture has the highest number of centenarians in the world, and this is people who live to be over 100 years old. The Nicoyans share the belief plan de vida, or reason to live. This outlook is an integral part of their culture as it directly ties into the concept of purpose. One way you can assess your own sense of purpose is by asking yourself, why do I wake up every day? To the Nicoyans, the answer to this question brings joy and happiness into their life and gives them quite literally a reason and motivation to live. Studies have shown that there is an obvious correlation between a sense of purpose and longevity. Having this sense of purpose has been shown to reduce the risk for Alzheimer's, arthritis, and stroke. Additionally, the Nicoyans live a life centered around family and community. They often live with their families and visit neighbors and other community members frequently, giving them the chance to share memories and cherish special moments with one another. Constantly being around others and loved ones brings laughter and positivity into the life of a Nicoyan, giving them a newfound sense of belonging. So the Nicoyans also all share common health practices that contribute to health and wellness in their community. They utilize methods of complementary medicines and therapies, the first being mind-body healing. The combination of humor therapy and relaxation promotes balance, rest, and improved immune response and the release of natural endorphins. Nicoyans also utilize biologically based approaches to health through their natural diet, high consumption of calcium-rich water, lower consumption of calories, clean and healthy diet, which we've already touched on, high levels of physical activity, and sunlight all contribute to the excellent health and long lifespans of the Nicoyans. So next we'll be talking about health disparities. So to begin this discussion, we are going to compare healthcare among Costa Rica and people of Nicoya to the United States. Per capita, the U.S. spends $11,172 on healthcare, while Costa Rica spends $910 per capita. Despite this large difference in healthcare costs, Costa Rica has a higher life expectancy and lower mortality rate than in the United States. The average U.S. lifespan or life expectancy is 78.79 years, while in Costa Rica it is 80.28 years. Mortality rate in the United States is also 18% higher than in Costa Rica among males and 10% higher among females. The lifestyle of the Costa Ricans plays a large role in this difference. The most common chronic diseases in the United States, which include heart disease, hypertension, and obesity, are just not as prevalent among the people of Costa Rica. For example, death from heart disease, the most common cause of death in the United States, is 54% higher than in Costa Rica. Healthcare in Costa Rica is effective, as these statistics have shown. There are not many health disparities that affect the people of Costa Rica, but one of the main barriers to excellent healthcare is the lack of highly specialized care. Although healthcare is easily accessible and universal, the lack of specialized care can cause faster disease progression after the disease has already started, as evidenced by less effective treatment of diabetes and those increasing numbers. While healthcare in the United States is centered around the treatment of disease, the Costa Rican and Nicoyan lifestyle reflects more of a primary prevention approach, which prevents disease from ever occurring. Their active, healthy, and positive lifestyles not only lead to lower rates of disease and higher life expectancy, but also promote much lower healthcare costs. As compared to Costa Rica as a whole, Nicoya has an even higher life expectancy, sitting around 90 years. Additionally, Nicoya is home to the highest number of centenarians in the world. Lack of specialized healthcare does not stop the Nicoyan population from achieving these extremely low mortality rates as compared to the rest of the world, which just goes to show how imperative it is to actually live a healthy and positive life.
Okay, so when talking about a patient from Costa Rica, there are some nursing concerns and considerations to be aware of. So some health disparities, of course, include old age, rural living, and low socioeconomic status. There was also a study that showed that there are way more chronic conditions seen in individuals with these factors than in those that lived in urban areas with more access to the healthcare needed. Additionally, public health policies in Costa Rica are aiming at improving social conditions associated to the poor health status of rural older adults. Additionally, there is also a language barrier to be aware of. So that would be a nursing concern because the predominant language in Costa Rica is Spanish. So a nurse trying to convey information that speaks English and a patient that speaks Spanish would be a little bit hard to do. And additionally, it should be known that malaria is considered an endemic, and so it should be remembered when treating those from Costa Rica. Also, remembering that Costa Ricans are motivated by reasons to live. So knowing this, and then this will bring us to our next point, health promotion and education for those in Costa Rica. So finally, there are specific ways as a nurse to care for the members from this cultural group in order to promote wellness, prevent disease, provide education, and overcome any possible barriers. So due to the fact that diabetes is prevalent for this cultural group, an excellent way to promote wellness would be educating on the importance of exercise and a healthy diet. As said previously, diabetes is a preventable disease, and we can help those from Costa Rica avoid this by simply promoting wellness to our patients. Another thing that we should be aware of is disease. If we have a patient we know is returning back to Costa Rica and is unvaccinated, we can tell them about the benefits of receiving the specific one for malaria. Since October of 2021, the World Health Organization has recommended the malaria vaccine among children living in regions with that high malaria transmission. And it has been shown to significantly reduce malaria and deadly severe malaria. So that's how we can really help promote wellness and prevent that condition of diabetes and anything regarding disease. And also, we should consider that most people from Costa Rica speak Spanish. So when communicating important information such as diagnoses, treatment plans, and procedures, an interpreter must be used. And so then that will help us create a great care plan for them and help us to achieve that holistic care.
How can we implement their practices into our everyday lives? First, we can start with self-reflection. What do I wake up for every day? What is my purpose in life? Do I spend enough time with family and friends? Do I spend enough time relaxing and enjoying the simple things in life? Do I consume a well-balanced diet and get plenty of physical exercise? All of these answers to these questions can change the trajectory of your life. It starts with you. What are you waiting for?